second poll in a week shows public support for the tandem of public and private health care options nearing three-quarters support from all Americans. And a key Democratic senator says she's not sure her Democratic colleagues will support it. In our third story in the countdown, the natural solution here, get new Democratic senators. The new CBS News New York Times poll shows 72% of Americans say they want a choice between a government-run plan and a private one, and that 57% are even willing to pay more taxes to get it. The poll also shows Americans trust the government more than private insurers, half saying Washington would do a better job at providing coverage, 59% saying it would be better at holding down costs. Yet this weekend, Senator Dianne Feinstein called cost control such a problem that the president, even though Democrats have the numbers, may not have the votes. So today, Mr. Obama began putting pressure on the naysayers, bringing back his old campaign slogan, "Yes, we can." He today pulled in AARP CEO Barry Rand to announce a deal with U.S. drug companies to cut prescription drug costs for the elderly, called the agreement a significant breakthrough on the road to health care reform. And this week, the president begins his pitch to the people, which includes a news conference tomorrow and a town hall meeting on Wednesday. Let's turn now to the former governor of Vermont, former DNC chair, and author of Howard Dean's Prescription for Real Health Care Reform, Governor Howard Dean. Thank you for your time tonight, sir.
Thanks for having me on, Keith.
If there are two polls in a week that show 70%, nearly three-quarters support for some form of government-generated health insurance, why is Senator Feinstein encountering resistance from other Senate Democrats?
One of the problems in the Senate is it becomes about the Senate instead of what's good for the country. The idea that 40 members of a determined minority can obstruct what 72% of Americans want is ridiculous. And you've got to put aside this notion that bipartisanship is always good. Bipartisanship is a good thing when both sides want to work together, but they don't. The Republicans just want to kill this bill, just like they tried to kill Medicare, and the Democrats have got to stand up to them. If we learned anything in the last 4 years, you only win when you stand up to obstructionism, and the Democrats have got to get their act together and move forward with this. A health insurance plan without a public health insurance option is not health care reform, and they need to get this done.
That 72% support figure in the CBS poll is everybody. The Democrats surveyed in this poll are 87% in favor and 9% against. And given that, if there are Democratic senators opposed to this, does not the only answer follow? You have to present the threat of new Democratic senators to replace those Democratic senators?
That's what will happen, but it's not a good thing. Look, these senators are good people, and what happens when you get in the Senate is you become consumed with what goes on in the Senate, and you lose touch with what goes on elsewhere. And this is exactly what I was trying to do when I first got to be the chairman of the Democratic Party. The votes are outside Washington, not inside Washington. It would be a disaster in the midterms and a disaster for the president if we allowed this bill to go down in the Senate. There has to be a public health insurance option. Three-quarters of the American people want one. What would happen, and I don't think the Democratic senators believe this, but it will look to the American public like these senators supported the health insurance industry instead of what was good for the American people. Let the American people choose. Let them make their choice. That's what they want here.
Even in terms of party loyalty, not that you want a bunch of obsequious yes men in every political party 100% of the time, but maybe 10% of the time. Is that okay? Is there no party discipline? The Republicans seem to be fairly good at that. Where is a little touch of that when the Democrats need it?
It's not so much the party discipline, it's the spine to stand up to people when they're really being obstructionist. The Republicans just appear to be tougher and more disciplined, and we have got to stand up and do what's right. 72% of the American people want the choice, including in places like Indiana and Delaware and states where folks can't make up their mind. We need a choice. The American people they don't necessarily want everybody in Medicare. They just want to choose for themselves. And I think it's time that the American people get to make that choice, and not the insurance lobby, and not the Senate, and not the Congress, and not the President, and not insurance company bureaucrats. Let the American people choose. That is the message. 3-1. And the people in Washington have got to make sure. We worked so hard to get this big majority. They've got to use it, and they've got to pass a public health insurance option, real health reform. Yeah,
72%, and by the way, among Republicans, it's 50-39 in favor. Governor Howard Dean, as always, thanks for your time tonight, sir.
Thanks, Keith.
But first, time for Countdown's number 2 story. Tonight's worst persons in the world. LeBron's the Citizen Patriots of Lancaster, Pennsylvania. It has 165 closed-circuit TV cameras trained on it, more than Boston or San Francisco. They're monitored not by the police, but by a company to which the project was outsourced. The company turns out to have hired Lancaster's residents to do the monitoring and call police if they see something amiss. In other words, they're spying on one another. The LA Times quotes a businessman, a beer and soft drink distributor, who calls it, quote, a great thing, and adds, there's nothing wrong with instilling fear. The beverage man's name is Jack Bauer. The silver shared tonight by Charles Krauthammer of the Washington Post and Bill Bennett of CNN, appalled that the president has referred to the chief Ayatollah as the supreme leader of Iran. Note the abject solicitousness with which the American president confers this honorific on a clerical dictator, says Krauthammer. We should be on the side of freedom and not on the side of this supreme leader, as our president keeps referring to, whines Bennett. Later the same day, John McCain referred to this guy as the supreme leader. In March, Senator Richard Lugar called him that 4 times in one hearing, and even William Kristol called him that in a column. It's a job title. But our winner is Cynthia Davis, who represents the 19th District in Missouri's State House of Representatives. The gold that is found off the beaten path. Representative Davis provides a few commentaries to a news release about the state's summer food program, which keeps feeding disadvantaged kids even while school is out. In short, Representative Davis does not get it. She writes, who's buying dinner? Who's getting paid to serve the meal? Churches and other nonprofits can do this at no cost to the taxpayer if it is warranted. Bigger governmental programs take away our connectedness to the human family, our brotherhood, and our need for one another. Anyone under 18 can be eligible. Can't they get a job during the summer by the time they're 16? Hunger can be a positive motivator. What is wrong with the idea of getting a job so you can get better meals? Tip. If you work for McDonald's, they will feed you for free during your break. It really is all about increasing government spending, which means an increase in taxes for us to buy more free lunches and breakfasts. 1 in 5 kids in Missouri is already motivated by hunger, Ms. Davis. And last year, because the meals are offered at churches, the $9.5 million of federal money spent produced 3,700,000 meals at a cost of about $2.50 each. It is embarrassing enough that Cynthia Let Them Eat McDonald's Davis is a public servant paid by tax dollars, but she's also the chairwoman of the Missouri House Special Standing Committee on Children and Families. It would seem that her advocacy of hunger would disqualify her from that job, and that we'd be better off if she was working at a McDonald's. Although clearly she has used and is using hunger as a positive motivator, because she seems to have been starving her brain of the recommended daily dosage of intelligence and humanity and oxygen. Missouri State Representative Cynthia, are there no prisons? Are there no workhouses? Davis, today's worst person in the world.